So good afternoon, everyone. Successful application of regenerative medicine solution for corneal ectasia. This is my topic. So this is the problem that in ectatic corneas, it becomes progressively thin and also curved. So the current solutions include contact lenses, collagen cross-linking, or in the advanced stages, corneal transplantation. So regenerative solution, if we think about the concepts that regenerative solutions have, then at one end of the spectrum, what we have is organ decellularization, which is done ex vivo. Native cells are then introduced into the ex vivo organ, and then finally we seed it and maintain it in a bioincubator. At the other end, we have wherein in vivo we introduce either ex vivo expansion of cells or recruit cells from the patient's own distant organs like the bone marrow. So we hypothesized, we started with a hypothesis that it is possible to thicken the donor cornea or to an ectatic cornea or a thin cornea by using a decellularized matrix hydrogel, which we can either make from a human source or some other source. And with time, as it integrates into the donor tissue, it becomes transparent using cues from the microenvironment that it is exposed to. So now for testing this, we initially created an animal model in the rabbits. Can you please escape from this, AV team? So for making this animal model, we created a stromal depletion in the rabbit cornea under anesthesia by doing lamellar dissection. The flap was then replaced and then the dead space was left as it is, and the animal was harvested at the end of 5 months. At the same time, we also developed a hydrogel. This hydrogel was made either from the human cornea or from bovine cornea sources. The corneas were minced, decellularized using enzymes, and they underwent lyophilization, digestion, and then created into a pre-gel format. Now this pre-gel was unstable in the pH, and therefore it was used by sodium hydroxide. It was stabilized. So what we showed was the DNA content considerably reduced from 100 to less than 3%. The other contents which contribute to the extracellular matrix, that is the glycosaminoglycans and the collagen content, didn't reduce very drastically, which is what we wanted. This gel was then injected into the animal model that we created, and at the end of the 5 months, the animal was sacrificed and the corneas were analyzed. So we have successfully shown that the matrix actually integrates into the cornea, and most of the cornea, if you can see, has maintained its clarity. One animal had an infection and therefore had this scarring at that area. So we showed that the hydrogel actually integrated, and also there was some migration of the resident cells. Now we also showed that the ectasia model was successful, wherein at the end of 150 days there was thinning in the cornea. This was also showed by CT-FIR mode images, wherein the depletion model that we created had the lamellar arrangement similar to that seen in keratoconus or other corneal ectasias. Now before I come to the advantages and drawbacks, I'd like to say that what we aim to do in regenerative medicine is to resurrect the normal anatomy and physiology of a dysfunctional tissue at a cellular and subcellular level. So we can either control tissue morphogenesis, deliver crucial signals to the resident cells, or deliver crucial signals by using infiltrating multipotent cells. So what we have targeted is using the resident tissue specific progenitor cells. Now the advantage is that this is the first model that has demonstrated a thinning for over 5 months. Secondly, we have used hydrogels, which are probably going to be much better accepted in clinics than any implant or any other stem cell source. So also time and cost effectiveness, and we have also demonstrated migration of the functional cells. So we intend to go for different sources of hydrogels, also recruit mesenchymal stem cells, and repeat the animals in a larger set of animals.
Yeah.
Thank you very much for your patient listening.
Just a quick comment, because we're already short of time.
That maybe we should also look at the stiffness after you have augmented the corneas with hydrogel, because that is the final test of.
Please be ready with
So since it was in vivo in the rabbits, and the rabbit cornea maintained its structure, but yes, we can measure. That's a good suggestion. Thank you.
Yes.